Hello and welcome. Hello and welcome again. And for the final time, hello and welcome, good evening. While we wait for more people to enter this expo session, I would like to remind everyone that November is Epilepsy Awareness Month. This year, our campaign is focused on encouraging people impacted by epilepsy to speak about their experiences through the Silence the Stigma campaign. If you haven't already, visit efmn.org to find more information. In addition, I would like to remind everyone that today is the last day to donate to the Give to the Max campaign in Minnesota. Donations make an impact throughout our organization in the daily work we do. This year, we have a $10,000 matching gift, so your donation will go further than any other time this year. Please visit efmn.org to make your donation. A link is being shared through the chat function right now. And with that, good evening. I'd like to thank you for joining us for the Innovations in Epilepsy and Wellness Expo. I'm Glenn Lloyd, the Executive Director of the Epilepsy Foundation of Minnesota. Today, we welcome Dr. Brandy Fuhrman to speak about how to improve overall health outcomes when you have epilepsy. Before we start our session, I'd like to go over some housekeeping information. For this webinar, your cameras and microphones are hidden as the focus will be on the speakers and the presentations. Following Dr. Fuhrman's presentation, we will have a panel discussion to talk more about today's topic. We will close with a Q&A session where you're able to ask questions to our experts. On the Zoom toolbar, you should see a Q&A icon. It should be right down here somewhere. You can ask your questions there throughout this session. Before welcoming out speakers, I'd like to introduce today's moderator, Tess Surzand. Tess Surzand has been a practicing neuroscience nurse for over 40 years. Besides her day job as a clinical nurse specialist, she served in a variety of leadership roles with professional associations and not-for-profit organizations. She is a past president of the American Association of Neuroscience Nurses and served 8 years with the Board of Directors and Professional Advisory Board, known as the PAB of the Epilepsy Foundation nationally. Tess has been a member of EFMN's PAB since 1996. The greatest joy of her work in epilepsy has been as a camp nurse with Camp Oz, back when she was still able to keep up with all those energetic kids. Tess, thank you for moderating our session tonight, and we really look forward to a wonderful conversation.
Thank you, Glenn. It is a delight to be here. And from the last count of our participants, we have had about 99 registered from Minnesota and beyond. So it will hopefully be a good interactive session as best as we can make it on Zoom. It's an honor to serve as your moderator for this very last session of the Expo. We have another excellent speaker just ahead, and in a moment I will introduce her. She'll complete her presentation, and as Glenn said, then we'll begin a panel discussion. I have one more panelist to introduce at that time. I want to strongly encourage you to submit questions. That makes these presentations so much more meaningful and robust. You can submit them via Q&A, as Glenn said, on your Zoom screen. So I'm expecting to hear from you, and I'm anticipating a robust discussion. Since November 5th, when our expo began, we have heard from epilepsy experts here in the Midwest and nationally. I hope the discussions that you've been able to be at have given you as much food for thought as they have given me. Expo, short for exposition, means a discourse designed to convey information or explain what is difficult to understand. Most of us would agree epilepsy is complex and at times difficult to understand. With the range of topics in the expo, from innovations to mental health, to newly diagnosed and intractable epilepsy, neuromodulation, research, comorbid conditions, medications and new treatment, and health equity and chronic health conditions, this expo has attempted to help us understand the complexities of epilepsy. Tonight, we will move to thinking about outcomes and actions we can take to improve our own health. As a very naive student in my first year of nursing school, 1972, I took a prerequisite class about health. I remembered wondering what on earth could possibly be addressed during an entire quarter, given that health simply meant that you were not sick. Thankfully, my mind stayed open as I learned in that class, and I continued to learn to this day that health is a dynamic state and one that is not simply or easily defined. And that is because a human being is body, mind, and spirit, each intricate and all connected. With that, I would like to introduce our speaker this evening, Dr. Brandy Fuhrman. Dr. Fuhrman joined the Epilepsy Foundation in 2016 as Vice President for Research and New Therapies and became the Chief Outcomes Officer in 2020. Her main responsibility is to ensure that the Foundation's activities result in better outcomes and quality of life for individuals and families living with the epilepsies. Dr. Fuhrman coordinates the overall direction of the Mission Outcomes team, composed of public health and education, government relations and advocacy teams, and the staff of the Wellness Institute and the SUDEP Institute. She also directs the Coordinating Center for the Epilepsy Learning Healthcare System and is a principal investigator in the Human Epilepsy Project and ensures alignment with the research and innovation team on an ongoing basis. Dr. Fuhrman previously served with the National Institute of Neurological Disorders and Stroke, also known as NINDS or NINDS, as a program director in the Channels, Synapses, and Circuits cluster, overseeing a portfolio of basic, translational, and clinical epilepsy research, including clinical trials. She was a Presidential Management Fellow at the NINDS, graduated from Cedar Crest College with a Bachelor of Science in Genetic Engineering Technology, and received her PhD in neuroscience from the Department of Neuroscience Anatomy at the Pennsylvania State University College of Medicine. Her research interests focused on molecular and behavioral change or behavioral effects of ion channelopathy and triggers of dysfunction in episodic neurological disorders. We are indeed fortunate to have her with us. Please join me in welcoming her virtually as she presents Improving Overall Health Outcomes.
Thank you, Tess. I am really delighted to be with you tonight, and I want to thank you and Glenn and the entire team at Epilepsy Foundation of Minnesota for the invitation to join you tonight. I wanted to share my slides and start by telling you that my recent transition to this role of outcomes officer at the Epilepsy Foundation has really allowed me to start thinking about the ways in which we can help to ensure that every individual person with epilepsy and entire populations of people living with the epilepsies can achieve their best outcomes. And it's been a wonderful experience for me to start learning, some new strategies to help move the needle. Previously, as you heard, my background was in research, and that is a critically important way that we help to ensure that people can reach their best outcome. But it's actually not the only way that we need to be paying attention to in terms of helping people live their best lives. So that's what we'll talk through this presentation tonight. But before I do that, I thought it was important to give you a little bit of context, both about the way I'm going to speak about epilepsy, but also about me and where I'm coming from. So I wanted to first say that you'll hear me use the word epilepsy a lot tonight, and I'm sure you've heard it a lot through the expo. And when I use epilepsy, I'm really using it as a shorthand for the epilepsies, because if there's anything that we're learning in the recent explosion of information about epilepsy, it's that epilepsy is not just one disease. It's not one condition, and it's really a collection of very different diseases that all share seizures as a symptom. And so it's important to know that I really mean all of those epilepsies when I say epilepsy tonight. The second point I want to emphasize is that we have to remember at all times that the experience of epilepsy is on a spectrum. There are people who are very mildly affected. There are people who are catastrophically affected. And we have people in every space in between. And so we have to consider our entire community as we're thinking through treatments, interventions, early diagnosis. All of those things need to apply to everyone across our spectrum. Last, that epilepsy is far more than just the seizures. Certainly the seizure activity is important, but there are many other features that make epilepsy difficult to live with. And so when we're thinking about ways to improve quality of life, we have to think beyond the seizures in terms of ways that we can help people live their best lives. I wanted to say a word about the burdens of epilepsy, and I've had some wonderful discussions with Glenn about this in particular. I used to say epilepsy doesn't discriminate, but I'm not using that phrase anymore, because while it's true that anyone can get epilepsy from any group in society, the impact of epilepsy or the same epilepsy diagnosis is not the same for all groups. And we have to hold that in mind at all times also. There are health disparities in epilepsy that affect specific groups more dramatically than others. And that's another area where we need to work to improve. We have to achieve health equity among people with the epilepsies. And then finally, a little bit about me. As you heard my background, I'm not a medical doctor, so I'm not going to be giving treatment recommendations. But I am learning. I've come from a background of neuroscience, of more basic research, moving into how do you get treatments into clinical trials, and then from clinical trials, how do you get onto the marketplace? And now I'm learning about public health. How do we really make sure that the things that we've learned from research, the incredible investments that have been made in research, how do we make sure that they actually translate and become ways that people and providers can use to improve their lives? Personally, I don't have epilepsy. My children don't have epilepsy, and so I don't have that personal connection. I can tell you my closest connection is the febrile seizure that one of my children had as a baby. And it was a surreal experience for me, because it was, after I knew quite a lot about epilepsy and seizures, and as he was having his tonic-clonic seizure in my arms, there was a part of my brain that was saying, this is a febrile seizure, this is very common, there's very unlikely to have any long-term consequences, he probably will never have another one of these again. And the other side of my brain was terrified and saying, please stop, please stop, please stop. So I do feel as though I've had a just tiny touch of the kind of feeling that must affect parents when they see their children having a seizure. But my commitment to this cause, my passion for this cause, really comes from the belief that we can make incredible differences for people living with epilepsy if we get them the right information, the right tools, the right treatments to help them achieve their best outcomes. And finally, a financial disclosure that my salary support comes from the Epilepsy Foundation alone, and the Epilepsy Foundation is supported by individual donors, by federal grants, by corporate sponsors, and that's the source of my personal salary support. Okay, so let's dive in. What do we think it takes for someone who's diagnosed with one of the epilepsies to live their best life? And how do we try to make sure that everyone gets that chance? I'm going to propose to you that there are a number of things that drive the ability to have an optimal outcome and quality of life in epilepsy. And I'm going to propose that there are 4 key drivers of those outcomes. The first is high quality epilepsy care. The second is access to community services. The third is having the ability to be in a supportive environment where you live, where you work, where you learn. And finally, the activation of an individual and family being at a high enough level so that the individual, the family can participate in the management of their condition, in making decisions about their care. So being an activated individual or family member. Now, each of these things certainly breaks down into smaller components that have to be there in terms of getting this driver to impact outcome. So we're going to drill down a little bit. And in the area of high quality care, we're going to talk about even access to care, being able to get access to the care that you need at the time you need it. The second piece I want to talk about is the delivery of evidence-based care. That is care that is grounded in the idea that we know that it works because we have data, we have clinical trials, or we have evidence to suggest that this intervention actually leads to best outcomes. And then finally, the third domain is new therapy development. We know that currently people with epilepsy, about 30 to even 40% of them, are not achieving seizure freedom with the available therapies. And so being able to continue pushing for new innovative treatments is an important piece of high quality care. Within community services, I'll touch on access to behavioral health programs. These are things that can impact comorbidities or co-occurring issues with epilepsy, such as depression or anxiety or memory issues, these things that make life harder when you have epilepsy. Assistance programs so that you can get connected to the resources that you need when you need them. We'll talk a little bit about supportive environments and how activities within schools or employers, or even just in the public space, can lead to a more supportive environment for people with epilepsy and their families, and that can help to improve quality of life. And then finally, we'll talk about 3 areas of individual and family activation: a level of understanding about epilepsy, the ability to do self-management or chronic disease management for someone that you take care of, and finally, self-confidence and activation to get involved, to start taking back some control and getting active in your own experience of care and wellness. So those are the topics we'll talk about tonight, and I'll try to briefly mention as much as I can interventions that the foundation, both at the national level and here in Minnesota, that the foundation is taking to really help to enhance the delivery of these drivers to help move people towards best outcomes. So we'll start in this area of high quality care. And I want to start with the idea of having access to healthcare in the system and new therapy development. And I really think that one of the best examples of the way that the foundation tries to make sure that this driver is available to everyone is through our advocacy work. I know there's very strong advocacy in Minnesota at the national level. We try to maintain a very strong presence at the federal level. with Congress and with representatives. We are always interested in engaging people through a grassroots advocacy network so that we can share the importance of access to care with our legislators, with our policymakers. These are also the folks who influence guidelines, regulations, legislation around new treatment development. So the rules and regulations at the Food and Drug Administration that a particular company needs to follow in order to get their device or their new drug therapy approved. So these are issues that we really take an advocacy stance on, making sure that access to care is person-centered and provider-directed. That is, that it's not an insurance company, requiring step therapy for you to get to the treatment that you need for epilepsy, but that your provider has said, this is the therapy that this person requires. Epilepsy is a very individualized disease, and so that is a provider-directed and patient-engaged decision. So advocacy, critically important. And this is one place where you can get involved, both in Minnesota and at the national level. And I encourage you to look at doing that. In terms of availability of evidence-based care, this is one of my favorite slides. I almost always show this. I think the last time I was in Minnesota, this was part of my deck. But the graph to me really tells two stories. The story of the incredible explosion of treatments, both devices, new drug treatments, went too quickly there, new device options and surgical options that are now available to treat epilepsy and to help control seizures. But it also shows us that these opportunities for treatment are very variable. People do not get equal access to these treatments. There are comorbidities, like we talked about earlier, depression, anxiety, memory issues, language issues sometimes, that can be underdiagnosed or untreated. And in some cases, drugs don't help improve those comorbidities. We have underutilization of effective treatments. So I'll use the example of surgery here. We know that for appropriate patients, surgery can actually offer a cure for seizures. About 70% of appropriately selected patients can become seizure-free after surgery. However, surgery is very underutilized. People are not referred to surgery at a rate you would expect for the numbers that would be eligible. And that is even worse in communities of color. Individuals of color are referred for surgery far less than what you would expect. And finally, we know that we still have higher early mortality for people with epilepsy than the general public. And that can result from a number of different factors. Suicide can be one of those issues, again, perhaps related to untreated depression or unscreened levels of depression. We also know that sudden unexpected death in epilepsy is an issue, and that we need to do everything we can to help people stay adherent to their medications, try to control seizures as much as possible, and do everything we can to strive to be seizure-free, including seeking out clinical trials or new interventions if the current interventions are not controlling seizures. So the other piece about this slide is that despite the fact that we have all of these different interventions, for very few of them do we actually know who is the person who should receive this drug first line, first off, because we don't have evidence about the comparative effectiveness of these drugs. So I'll give you one example where we do know that answer, and that is with ethosuximide. Here, one of the earliest discovered drugs for epilepsy, there has been a comparative effectiveness trial of ethosuximide versus a couple other drugs that were typically used for absence seizures. It turns out that ethosuximide does the best at controlling seizures and limiting side effects and being tolerable, that is, someone can tolerate an effective dose of the medicine, compared to the other treatments that are being used for absence seizures. And so typically ethosuximide is the first line therapy for someone who presents with absence seizures. There is almost no other drug for which we have that kind of information. And so for many people, having a diagnosis of epilepsy is really just the first step into a process of trial and error about which is the drug that's going to control your seizures best. And that really is one of the things that is limiting our ability to use evidence-based medicine to get people to their best outcomes as quickly as possible. So you heard in the introduction that I'm involved in a group called the Epilepsy Learning Healthcare System. And this is a sort of a new approach to delivering healthcare in epilepsy so that we collect information about which of our interventions have had good outcomes and which have had poor outcomes, and then systematically learn from that so that when the next patient presents, we have a better idea of which might be better treatment options for that type of person. This is a quality improvement network. It's a group of epilepsy centers across the country who are working together to gather that kind of information together so that we can learn those kinds of answers. And so I've shown you here, there are site teams at each epilepsy center, and they actually are composed of all the stakeholders that you would want to have involved in a health promotion kind of team. So it actually includes patient and family members giving perspective on how this intervention is seen or used. It includes providers who bring their medical expertise. It includes community services partners, groups like local Epilepsy Foundation staff who can offer additional kinds of services that wrap around so that that person can get comprehensive care for their epilepsy. These site teams work together and they, again, collect information from patient visits and send that to a central registry here. And you see this core group in the center. That central registry then helps the teams do planned cycles of improvement. So if we know that at baseline your outcomes were X, if we do an improvement intervention, can we get your outcomes to improve? And we just keep doing that over time, over time. And as we see improvement, we then can share that improvement across all the other centers in the network so that we very quickly can disseminate what is working well and what is not working well. It's really a system of learning across this whole network. And I really believe that this is one way to make dramatic improvements in the type of care that's delivered to an individual because we will be learning more quickly what works for each individual person. So developing that evidence is going to help us to make sure that we can deliver it to people and help them achieve their best outcomes. So I also mentioned that research and innovation is a critically important part of being able to deliver high quality care. As you've heard me talk in the past when I've come to visit Minnesota, the foundation has a very long history of investing in products or concepts that will help improve life for people with epilepsy. And here down at the bottom, I've listed just a few that have come through either our Shark Tank program, and I want to thank Minnesota again for being a wonderful partner. Minnesota has helped to sponsor this Shark Tank event in past years. So these have either come through the Shark Tank or our new therapy commercialization grants. Sorry, I'm a little too quick on the trigger there. Okay. And so we've been really proud to see that some of these things that we've invested in have now ended up on the market. So I'll point to this ZEEG by Zito. This is a wireless headset for EEG, and it can be delivered much more conveniently without the glue that is so frustrating for people when they're getting their EEG done. But it can also be used in out of hospital settings, which can offer some benefits, especially in a time like COVID. We've also invested in things like the SUDEP Biomarker Challenge, trying to offer a prize for a group that can identify a predictive biomarker of SUDEP so that we can understand who's at highest risk and put all our efforts toward prevention. We've also invested in My Seizure Gauge, that's this diagram here on the top right, to try to help to determine when someone is at highest risk of a seizure. We know that living with epilepsy means living with unpredictability. And so if we had a gauge that could help determine what is your risk today, that might offer some peace of mind and better quality of life for people with epilepsy. So again, investing in research and new innovative therapies is an important way to begin to encourage best outcomes. So now I want to move to community services and their role in helping to ensure that someone can experience comprehensive care. So not just their physical or medical health, but also mental health and wellness. So we'll talk about access to behavioral health programs. There is a wonderful group of centers across the country called the Managing Epilepsy Well Network. And this is a group of centers that are developing behavioral interventions for individuals with epilepsy. And they are focused on a number of different areas. So they have created self-management programs. They have created memory enhancement strategies. They've created programs for depression, for anxiety, mindfulness programs. Each of these have been demonstrated to improve quality of life for people with epilepsy. And so these can be a really important part of a treatment plan for someone with epilepsy. So I encourage you to take a look at the Managing Epilepsy Well Network programs and talk with your providers about whether these can be available to you. There's also a website, the MU website has listings of providers who offer these programs. I also wanted to call out the 24/7 helpline that is offered through the national office. I know there's also a helpline offered through the Minnesota group, and I have that number at the end of my slides. At the national level, we offer resource connections, and they can be offered in English or in Spanish. And again, they're offered 24/7. So if you have a question about epilepsy, if you have a question about getting access to assistance in your community, this helpline can provide some support. We also offer bereavement support through our SUDEP Institute, and this is available to someone who has lost from epilepsy. Again, for any reason, it's not limited to people who have lost from SUDEP, but for anyone who has lost from epilepsy. Okay, now I wanted to talk a bit about the idea of building supportive environments for people with epilepsy and how that can contribute to improved quality of life. I think those of you in Minnesota are very familiar with the Seizure Smart programs that have been offered here for many, many years. And I'm really glad to say that the idea of having Seizure Smart or Seizure Safe education is really taking off across the country. So at the national level, we've dubbed this our Seizure Safe Nation initiative, and the schools piece of this initiative is one of our first real goals in terms of getting everyone across the country legislation that helps to ensure that students in schools will have a safe environment. So here you see an educator providing school nurse education. We have training for school personnel. And I know that there are many other options available for training through Epilepsy Foundation Minnesota as well. So this idea of offering seizure first aid, both to school personnel and to the general public, is one way that we can help create supportive environments for people with epilepsy, no matter where they live, work, or play. In terms of legal advocacy, there's also some resources available through the Jeannie Carpenter Legal Defense Fund. We have disability rights experts at the foundation who can help to answer questions about workplace discrimination or other questions about your rights especially under the ADA. This year, many of you may know that was the 30th anniversary of the Americans with Disabilities Act, and we were a critical partner in helping to make sure that that legislation became law and was implemented in a way that benefited people with epilepsy. At the national level, we will be offering an employment program, and I understand in Minnesota there is already an active employment program. So again, these are efforts that will help to provide more supportive environments for people with epilepsy and hopefully improve quality of life. So I want to finish up with the idea of individual and family activation as one of the drivers of best outcomes. I think it's really important for people to understand that knowing something about your epilepsy is going to put you in a much stronger position to achieve a better outcome. Number one, understanding what kind of epilepsy you have, understanding your seizure types is very important. And that's because today, most treatments are determined by the type of seizure that you have, or seizures in some cases. So I'm sorry about that. Let me go back to here. Oh, sorry, everyone. I'll try to do this very quickly. Okay, this is where we were. And I promise I will stop touching my keyboard. Okay, so the idea of being informed enough to be able to ask questions of your doctor and take an active part in making your treatment decisions is a really important factor in developing best outcomes. Now, I want to show you this slide only to emphasize that one of the key pieces of information that you should know or ask your provider about is, what seizure type do I have? If your provider can't answer that question, I think you need to find a new provider, because one of the most important pieces of an epilepsy diagnosis is your seizure type or types. And that today will drive your treatments. Most of the medications available on the market today were developed with one of these seizure types in mind. And so whether you have a focal seizure because you have a genetic mutation, or you have focal seizures because you had an injury, a head injury that later developed into epilepsy, you will probably receive similar types of medications. However, the seizure types are, I think, going to become only one of multiple ways in the future that medications or treatments will be chosen. The direction that research is going now is to really understand the etiology of your epilepsy. And that's another way to say, what is causing the epilepsy to appear? So I'm going to drill, there are a number of different potential causes of epilepsy. You can have structural malformations in the brain. You might have a genetic variant that gives rise to epilepsy. You might have had an infection in the brain that has led to seizures. There might be a metabolic imbalance. There might be an immune reaction happening in the brain that can lead to inflammation and seizures, or your etiology may be unknown. I want to drill into just one of these etiologies a little bit deeper to show you how in the future treatments are going to be developed that will be more specific to etiology than they are to seizure type. So that's really the transformation that is starting to happen in our treatment development pipeline. So I'll show you here on this slide. If you look at 1996, which is when I started graduate school, there were very few genes identified as being genes that caused epilepsy. Today, all the way 20-ish years later, we now have hundreds of variants that have been identified as being related to causing seizures, either in human beings or in animal models. And what that does is tells us that there are many ways that an individual variation in a gene can lead to seizures. And those pathways could be new places for us to intervene with drugs or other types of therapies, particularly genetic modifying therapies. And that will allow us to have more precise, more targeted treatments for each individual person based on their particular genetic profile. So again, this is only one example, and there are many other types of etiologies, but it's one of the reasons why I think that it will become more and more possible in the future to get a treatment that is much more tailored to an individual than our treatments are today. Okay, another way to get activated and get engaged in your care is to learn how to do self-management. So there is a wonderful program, again, developed by the Managing Epilepsy Well Network called PACES in Epilepsy. And it stands for Program of Active Consumer Engagement in Self-Management in Epilepsy. And this is relevant for adults. My understanding is they are developing a similar process for children with epilepsy. So this PACES program can actually give you the tool set that will help you improve your ability to manage epilepsy. And so an excellent way to move yourself towards best outcomes. I also wanted to highlight that the Epilepsy Learning Healthcare System, if you see this form over here on the left, is developing tools like screening tools that would identify things that get in the way of taking your medicine. What is it that keeps you from being able to be completely adherent to your treatment regimen? We recognize it's hard to take medication every day, multiple times a day, multiple medications a day. And so we are building tool sets that can help you, if possible, do more to be adherent to your medications. And it's possible for you to get involved in developing tools like this. This is where we're asking patients and family partners to give feedback on, the tools that we're developing. Are you understanding the questions that are being asked? Is there a better way for us to approach saying this to you? What are the kinds of feedback that you would like to be able to give to the provider, but sometimes don't have enough time to talk about in your very short visit? So those are the kinds of things that we can ask for in terms of feedback from patient and family partners that can really help us develop tools that are most useful to patients and families. So I've gone through a number of different pieces of this puzzle, the things that I believe are important to drive toward best outcomes and quality of life. And I want to end with the idea that the very most important intervention that we can think about in terms of how do we get our whole community to this best possible outcomes and quality of life is to have you get engaged. You get involved and take the actions that you can take to help make sure that both you, your loved ones, and others in the epilepsy community can make it to their best quality of life. So I want to end with a picture of this beautiful little boy, Nihi. And Nihi's story is just a wonderful story of hope. He was having uncontrolled seizures. Medications were not working. His family reached out and found the Epilepsy Foundation, who connected them to a provider who was able to give Nihi the ketogenic diet. Now, this is not a typical treatment that gets a lot of press, although it should, because it can be very effective for people in certain groups of patient populations. And luckily, Nihi was in one of those categories of patients who responded very well to this diet, and his seizures stopped. He was able to come off of medication, and today is seizure-free. He is a wonderful little boy with an incredibly supportive family who's been able to benefit from evidence-based care and a very supportive community and community services. And so that's the kind of outcome that we want for everyone with epilepsy. So I want to thank you for your attention, and I'm happy to join the discussion and answer questions.
Well, I'm not sure that could have been any more packed with information and food for thought for us. Let me get to one thing here. We're going to give you just a little break, Dr. Fuhrman, while I introduce our additional panelist. I'm looking at the clock and I'm thinking it's 6:45 or so. I don't know if we're going to have enough time to get to everything that is certainly on my mind after hearing what you said, but we'll give it a go. And welcome now, Dr. Armentina Espinosa. Dr. Espinosa is a pediatric neurologist at the Minneapolis Clinic of Neurology here in the Twin Cities, with particular interest in epilepsy, autism, ADHD, headaches, head injuries, movement disorders, and sleep disorders. Dr. Espinosa is also Pediatric Neurology Medical Director, Pediatric Brain Injury Clinic Medical Co-Director, and Pediatric Sleep Clinic staff member at Hennepin County Medical Center. Dr. Espinosa's training included a Doctor of Medicine from Centro de Estudios Médicos in the Dominican Republic, a pediatric neurology fellowship at the University of Minnesota Medical School, and a sleep medicine fellowship at Hennepin County Medical Center. Dr. Espinosa is a member of this Child Neurology Society, American Academy of Sleep Medicine, American Epilepsy Society, and Professional Advisory Board of the Epilepsy Foundation of Minnesota. So welcome, Dr. Espinosa, to the panel and to our evening, which seems to be flying by. I want to start by asking Manti. I'm going to refer to Manti as she likes to be called, and to Brandy as she prefers, as Brandy. I would like to ask Manti, first of all, just to reflect on what you've heard from Brandy this evening, and just maybe some of those bigger global takeaways that had an impact on you.
So I agree with you. This is a most comprehensive and at the same time, very down to earth, patient-centered talk. And I'm so proud to be part of it. I think it applies to everyone and anyone who has a loved one or who themselves have experienced any of the epilepsies. So it highlights, Brandy has highlighted the patient care, quality of life outcomes from the perspective of the patient, the client, the family, and also the providers. The providers also including, I would agree, nursing staff at the school levels, which are our ambassadors, I should say that, the teachers, the whole team. This is totally a team approach. And for better outcomes, we definitely have to work together in education, information, data gathering, updating with the families. The point of the epilepsies as the causes, the etiologies, and the types of epilepsy, communicating that to our patients and our families is also critical. And this is also a learning, as you mentioned, it's also a learning track for many of us providers, because many times initially it is not very clear what is the seizure type. And we're also learning that there are concomitant seizure types in the same person, in the same individual, as well as a variety of etiologies, of which the genetic etiologies are becoming more and more evident. Yeah. Particularly with development, the comorbidities, developmental delays or differences, autism, learning disabilities, ADHD, the mood disorders, depression, anxiety, the sleep disorders. So this is a whole combination of factors that are very important for all of us to keep in mind and to continue in the quest of all of us, education, information, updating patient quality of life, and the goal of no seizures. Mm-hmm. I think also we are very blessed in Minnesota. We have very excellent resources for a whole variety of epilepsy care services. So we are in a good place, but there's always room for improvement, I think, for all of us. Mm-hmm. So this is wonderful, a very, very, very timely talk, very timely presentation.
Mm-hmm. Well, and I think as I listen to you, putting it together the way you did, I think generated a feeling of hope in me, and I hope in some of our other audience members. We have our trajectory in epilepsy care has, you know, the graph you showed with the treatments and the medications, but I think concomitantly we have been able to understand better the effects beyond just the physicalness of our being, just of the body. And that has really enriched and enhanced our ability to have more effective things happen with our patients on a day-to-day basis. One question I have, and this is not on our list. We kindly received a list of questions from our helpful staff members at the Epilepsy Foundation of Minnesota, but we may just deviate from that a little bit. I really want to hear more about the epilepsy learning healthcare system. And where is that? Is it fledgling? I've not heard of it before. And
Sure.
I would like to know, can we get it in Minnesota or do we have it here? And I'm just ignorant of the fact that we do, because it sounds like we need to be connected to that.
I would love to have you all in Minnesota be part of this. So it's right now 13 different epilepsy centers across the country. And I could go down them in my mind, but there's a page on epilepsy.com /ELHS, which we say Ellis as a shorthand for the Epilepsy Learning Healthcare System. But they are centers like Massachusetts General Hospital in Boston, Children's Hospital of Orange County in California. We have Texas, University of Texas Southwest Children's. So centers all across the US, Barrow Neurologic Institute in Arizona. And these centers are partnering up with their local epilepsy foundations and other community services groups in their local areas. And so we would absolutely love to have representation from Minnesota. You have such wonderful epilepsy centers here, and certainly Epilepsy Foundation of Minnesota, such a strong affiliate, and we would love to bring them into the network.
And is this something, so right now, as I heard you, it's the institutions, the epilepsy centers, to gather additional data to help drive evidence-based interventions.
Yes.
That's a very shorthand way of saying.
That's a lovely way to
compressing
say it. It's right.
complexity.
Yes.
Okay. So if I'm a person with epilepsy, then I will benefit from that, but it's not like I call up and say, give me an appointment at the epilepsy, epilepsy learning healthcare system. I may be the beneficiary of that, but it's not a center where I go for an appointment per se.
Well, if your center is participating, yes, you would be able to benefit from that and be part of that. We have had folks who have worked with their local institutions to say, take a look at this. This is a new model. I would be interested in your offering this, to our community, those kinds of things. And certainly we can work with centers and physicians and other providers at centers to try to make the case at their institution that this is a worthwhile investment, that they want to be part of this cutting edge network to really develop the best practices that we need.
Yeah. Because
Randy, I have a quick question.
Yeah.
If we wanted to pursue this within Minnesota, is there a role to do this through the Epilepsy Foundation, all the different epilepsy centers here, or is it more desirable to do it individually via the institution? Or is there any state that does it through the state foundation?
I think it will need to be both, right? Because ideally we have to have the buy-in from the institution, but also the support and engagement of the foundation. So I think this is something that Glenn is very interested in, and so maybe we can have another conversation about it.
Absolutely, yes. Good.
Okay. Glenn, do you want to jump in at all on that? We'll welcome you to the panel if you want to jump in.
Listen, all you're doing is building the case. And so I'm going to say out to the rest of the world that if you'd like to see this, as much as Dr. Espinosa and Tess have said, we absolutely at the foundation are super energized by this opportunity. And our hope is in 2021 to build the community's support behind us doing it. So yes. Do you need another yes? I'll get back out because this is a great conversation going on.
All right. Well, and I think our history of being collaborative, and I'm thinking of the professional advisory board we have, our history of being collaborative around that board table. And Manti, you've been on the PAB here in Minnesota longer than I have, but I've always thought of it when we get around that PAB table, we are talking about people with epilepsy and best care for people with epilepsy. And we don't say, you know, my organization does it this way and my organization does it this way. The focus is so patient-centered around that board table that I think, and we've got representatives from greater Minnesota too, and it's not just the metro area. And I think that that is gigantic to activate, which I love that word. It's just got so much energy in it. But to activate our state to be involved in that. I don't know. What do you think, Manti?
Oh, I agree. I think this is a wonderful project. The outcomes can certainly be enhanced. And I love the idea too of reaching cross-culturally as well.
Yeah. All right. Well, check. That one's done, Glenn. We know you and Brandy will carry this forward for us. I want to talk a little bit. I'll come back to that one. Let's go to this first question because I think it's really a practical one. When you talked about individual activation, Brandy, aside from taking anti-seizure medication or anti-seizure drugs as prescribed, which we know is critical. We know is a critical thing to do. What can individuals with epilepsy do to improve their seizure control and overall health?
Yeah, that's a great question. And I'm sure there's multiple answers to it. And so I hope each one of you will contribute. But one of the first things I would say is that to never give up hope, to never stop trying, that if you are continuing to have seizures, that there is a new experimental therapy in development right now. There's a new experimental device. There are diets that are coming out all the time. There are new things hitting the market every year. We just had several new drugs approved in this past year for epilepsy. Cenobamate, the new Dravet syndrome drug, fenfluramine, there's all of the rescue drugs, right? We've got now all of these rescue medications. So there's always something new happening. And if what you're doing right now is not working, let's look for what else could be out there. So that would be, I think, my first question.
Well, and I think the hope is critical. And to balance that with, as you said, the trial and error that has to go on sometimes. You know, we say the focal epilepsies, and these drugs, how many of them have been approved for the focal epilepsies? Well, you know, we will get to that point where we'll know it's this gene variant and this type of focal epilepsy, this drug. But right now, maintaining hope and maintaining persistence in that trial and error process, I think, is a huge challenge for somebody in that 30 or 40% of individuals that don't have seizures controlled. And I want to flip this to Manti from the pediatric perspective and how you deal directly with the child that's in this trial and error situation, and how do you keep the hope in that family system, which sounds like an insurmountable thing to me. I always worked in adults, so I applaud you for your work in pediatrics.
It's always a work in progress, but I like the idea, like you mentioned, hope. I always like to mention the goal is no seizures or the least seizures possible. We don't have, except like it was mentioned in the talk, that the only medication with evidence-based results data is for ethosuximide for absence. So we have to explain carefully to the parents and not being shy to repeat things. And I always tell them, always ask me again. There's no no
Mhm.
problem repeating the questions. We review again that different medications can work synergistically or different mechanisms of action. We have to be also at the best level that has the no negative side effects. So multiple things. When I work with kids, as soon as they are able to have a little bit of comprehension, and surprisingly, this can be very, very young, I always like to include them in the conversation, from as basic as, do you prefer to swallow liquid or tablet? And I always ask the parents every time I see them, any barrier to the cost of the medication, any barrier to the insurance, any barrier to getting to the pharmacy.
Yeah.
In these times, as we know, in Minneapolis, there have been pharmacies that have been closed because of civil unrest. So just the basic little steps. Can you obtain the medication? Can you swallow it? Is it pleasant or unpleasant? So all those little steps. And then the word hope is very, very important, that we're going to look positive to this. And the fact that there are many strategies. We're not at the end of the road by any means.
Mhm.
We have medication, we have diets, we have evaluation for surgery approaches, many things. So the whole idea is balancing the quality of life with the seizure, the epilepsies, and the comorbidities, which sometimes the comorbidities are more of an issue than actually the epilepsy itself. So it's always a balance. Every visit is a new review.
Mhm.
Um,
Well, and you hit on something too with the comorbidities and what we can do aside from taking anti-seizure medicine. And that is to try and understand the rest of me as far as other conditions that are at play with me. And I don't mean play in that kind of way, but I mean that are having an effect on me. The result of which, and I love how you said that, there's common things that people experience, common conditions, but the common denominator, or a multitude of conditions, but the common denominator is having seizures. But what's my story? What is my individual situation and information? And I think the other thing that's very practical to me too is to ask questions of your provider, of your resource at the Epilepsy Foundation of Minnesota, of somebody who you think knows more about epilepsy than you do, of your support group comrades. Ask questions. And I think it can be difficult when you're in the middle of not having hope or not having seizure control, to become not as activated, not as engaged, and to keep asking the questions that might be deep inside of you, because that will, I think, help you get to a point of better understanding about your situation. And once you have that picture of yourself, at least for that point in time, then you can figure out an action step or two, or then maybe three, that you can take control of and move yourself forward to a better place. And there's the hope again. So it's all twined up together. And I applaud Brandy and colleagues at the Epilepsy Foundation nationally for teasing this out in a way that I think is much more understandable. Go ahead. Or did somebody say something? I looked down. All right. Here's one, I think, Manti, we'll give this one to you. What role should epilepsy care providers play in promoting overall health beyond the scope of treating their epilepsy?
So, because I also have an interest in sleep medicine, and I had a prior educational background before medical school, I talk a lot and keep learning a lot about sleep hygiene and the importance of sleep, helping decrease the risk for seizures. and maximizing alertness during the day, and also the other comorbidities. So I want to always make sure that I'm not missing on those pieces. And like you say, always asking and listening to the parents and the patient, see what they are experiencing or what worries them. With families, sometimes it's more, one parent brings more information than the other, and that's very common. But the issues of insufficient sleep, poor sleep hygiene, poor sleep quality play a huge role in the quality of life for all of us, but in particular for those of us with epilepsy. So I try to really continue education, information, support. Very often I will refer to the sleep clinic if there's any concern with sleep apnea, for example, or movement disorder in sleep, or when we get the 24-hour, 48-hour EEGs to, a plan of that is also to look at the sleep recording in the epilepsy is very important. And I work very closely with neuropsychology, both at Hennepin County Medical Center and in the other resources, Fraser, University of Minnesota, etc. So I like to be as thorough and in depth as I can. Sometimes we have to go a little bit at a time. We cannot do the whole thing in the first visit, but I cannot lay the outline in the background and say, we're going to tackle, by prioritizing, but not missing these other points too. So safety is also a big one. And we really also tackle about safety, avoiding head injuries, any situation where the child or the young adult may be at risk for having a seizure and not being safe. So it's always education, information, part of the visit too.
Can I just touch on?
Sure. Yeah, go ahead. I'm sorry. I want to say here, the school nurses are huge. I have to say, as a huge source of information and support and education. Go ahead. I'm sorry.
Oh, no problem. No, I was just going to build on what you were saying about sleep issues, in that we recently published a study on children with rare epilepsies and looked at how their sleep disturbances impacted their caregivers. And so when a child with epilepsy had sleep problems, their care providers also had sleep issues, and that was associated with poor mental health and also poorer quality of life. So that really has to be in your mind as well. Taking care, if you're the care provider, taking care of yourself is equally important.
Right.
Once you are into those patterns, it's sometimes hard to keep up all the resilience you need for caregiving. So
Always.
Putting your own oxygen mask on first is really important.
Yes, it's bi-directional, also with the mental health as well. So yeah, totally true.
Well, let's talk a little bit about the relationship between mental health and physical health and determining overall health outcomes. You mentioned earlier anxiety and depression, and how those are very real things for many people with epilepsy that are there all the time and have to be managed. How do we help patients navigate that, Manti? How do you help patients deal with that mental health, physical health duality that are having impacts on them?
Well, from the get-go through the first visit, I always try to make the connection. It's all brain, and best brain health is good for all of us in all aspects. So I will always emphasize a connection of mood, sleep, learning, seizures, headaches, all these things. And one improvement in one area helps the other. They're all different compartments, but they're all together. Also, many times when I see them, the primary provider has already identified that there is some issues with mood disorders, anxiety and/or depression, adjustment disorders. Sometimes I'm the first person to ask them, but often not. The primary very often picks up on that. And again, I work very closely with behavioral health, neuropsychology, and I will explain and review with the child and the parents that overall well-being of moods helps also with better seizure control. At some points, in some patients, it also becomes reasonable to consider the possibility of non-epileptic seizures. And these are sometimes higher with these other disorders. And they're not mutually exclusive with epilepsies. So we have to be very careful not to overcall or overdiagnose and try not to underdiagnose either. So it's always best in collaboration with other experts. So I work closely with psychology, psychiatry, and neuropsychology. And so hopefully to get to a best plan of care and best quality of life.
Brandy, what in terms of mental health issues is the epilepsy? I have to always look at my notes because that acronym is not in my head yet. You know what I'm talking about, the Learning
I
Resource
do.
Center.
That's why we call it Ellis. It's
With
just
Ella.
easier to say.
So, and I'm thinking about epilepsy and how we've talked about epilepsy being stigmatized. And we had the campaign years ago of coming out from the shadows. And, you know, over the years, I think we've done some really good things in that direction. But I think we're suffering, I think is a fair word, from that same scenario with mental health issues. People are embarrassed. People are afraid to admit that they might benefit from having a therapist. What kind of practical things is Epilepsy Foundation nationally and maybe via Ellis doing in that regard?
Yeah, we're actually doing a couple of things. So first, I'll tell you about our partnership with the Managing Epilepsy Well Network. They have provided these evidence-based behavioral health programs. They've done the research, they've shown the evidence. Our partnership with them is to really start to get these disseminated out, to get these out into practice so that people can get access to them. So that's one thing we're doing, is trying to take these programs like Project Uplift or the Hopscotch program, which is a memory improvement program, get them out into the public so that people with epilepsy can access them. And we're doing that actually through our cooperative agreement with the CDC. That's been part of our funding to do that. The other piece that we're doing is developing a training for behavioral health providers about epilepsy, so that more of those, you know, psychologists, social workers, folks who offer mental health services can start to get more comfortable with epilepsy, so that they have more knowledge, they can begin treating folks and really specializing in some of the issues that people with epilepsy have. Then the third thing in Ellis, we are building into the standard visit flow the question, did you screen this patient for mental health or behavioral health issues? So did you, give them one of the common screening tools for anxiety? Did you give them one of the screening tools for depression, ADHD, if it's a child, those types of things, so that those things don't go unnoticed in the visit. And if the score suggests that that should be a conversation, that gives a prompt for that provider to have a conversation with someone about, their depression, their anxiety, or other issue, and then make the appropriate referral if that's the right next step. Sometimes it's something that provider might be able to handle, directly. Other times you want to make a referral to a mental health professional. And so that just ensures that conversation, if it needs to be had, is being had.
And you mentioned the first program that you mentioned
with the Managing Epilepsy Well Network,
the behavioral components. So I'm thinking of the family in Greater Minnesota who has to drive X number of hours to maybe even see their primary care doctor, or let alone see an epilepsy specialist. How are these programs accessible to people throughout our state and in areas where they might not?
It's a great question. And some of these programs are phone-based. They can be, Zoom-based, just like this conference that we're having. Yeah. So they can be more accessible to people as long as they have access to internet or access to a phone. That's really the baseline there. But even in terms of accessing an epilepsy specialist, I think that one of the silver linings, if there are any, of the pandemic is the acceleration of telemedicine and really loosening up, some of the rules around telemedicine that had been in place for so long that were
Yeah.
real barriers to being able to use telemedicine. So now, nearly every institution is offering virtual visits. And
Mhm.
so if you live 4 hours away, if you live 6 hours away, if you live, 20 minutes away, they're
Yeah.
all on virtual visits.
Mhm.
So that might offer an opportunity for somebody who wouldn't otherwise have access to a specialist to be able to have a virtual visit and ask those questions of a specialist. I think that's a real, actually a very good opportunity for people right now.
That's terrific. Manti, have you seen that impact your practice, and how have you seen it impact your practice? Telemedicine, I'm specifically referring to.
Yes, absolutely. For neurology clinic, TBI clinic, sleep, and then referrals to behavioral health, mental health as well, all across.
All through the.
Yes.
And do we do anything with following up with patients as far as their satisfaction level? I'm just that was a random thought that went through my head. Are people okay with they get access and they get one-on-one time, and I just wonder what the satisfaction level. I haven't seen any data or follow-up or anything like that in general.
We
I
did
don't know.
a quick survey. It was not terribly many people. I think we were at about 100 people. We created a telemedicine checklist in
Uh-huh.
Ellis to kind of get you prepared for your visit, and then things that you should be have ready before you meet with your provider by telemedicine. And then we did a survey about how useful that checklist was and how satisfied were you with your experience. And I would say most of the respondents to that survey were on the satisfied end of the spectrum. A few people felt like the visit was not as personal. They didn't have as much of a connection. But
Yeah.
many people mentioned, I really appreciated not having to travel with my child, not having to disrupt their routine, being able to, have a much easier time because they didn't have to physically go to the visit. So
Mhm.
my sense was overall people were fairly satisfied with telemedicine visits
Okay.
from our small survey.
Okay. So there's a couple of questions that have come in from the audience about living in Greater Minnesota, and how do I get connected with places for a telemedicine consult? Or I think you call up and say, here's my situation, and then you advocate that happened for you, and that you set up the visit that way. I mean, there are certainly components of a live visit that are advantageous, but we know in the world of COVID, connecting with somebody live and in person via the internet is very close to second best right at the moment. So,
Yep.
So that I
And
think addresses a couple of the questions that I'm seeing here.
Tess, do you think it would be worthwhile to mention when somebody should seek out specialty care? Because I think some people are
Mhm.
unsure or not clear if they should go see an epilepsy specialist, right?
Mhm.
When
Mhm.
would people when should people think about doing that?
Well, I'm going to address part of it, and then I'm going to ask Manti to address part of it. One thing I have told patients that I've worked with when they want to change their doctor is there's not a loyalty factor here. This is about you and what's best for you. And it may feel selfish. It may feel like you're abandoning a relationship, but that's not what this is about. And you could use the example of if you took your car to a mechanic. Our bodies are way more complicated than that. But if this mechanic is repeatedly not making you happy and not doing what you asked him or her to do, you go find somebody else. And that is a simple way of saying you've got to look until you gel with somebody, until you have confidence and trust. And as one of the physicians said on the on a previous one of these expo meetings, till you feel that you can ask any question that you want to and feel comfortable doing that. And that's called trust. And that's up to you. You know, a doc isn't going to say necessarily, well, go find somebody else. But I think you have to be the one to do that advocating. Manti, what do you think about that?
No, I totally agree with you. And I've learned through the years that I feel very comfortable also because this is not an ego thing. We want our best goal is the goal of the health of the child, the patient at any age, and the family to understand what this is about, for them to feel comfortable and understanding the whole picture as best possible. So I always will tell the patients, particularly when there's, you know, a little bit longer till we get to seizure freedom, at any time, if you want to consult with anybody else, I totally will support you, and I'll be happy to touch base with you again back if you wish or not. So the door is always open to an outside referral or to return to me, because we're all in the same boat here. We want the health of the patient as the best goal.
Yeah.
And sometimes it's not that that they have more questions, or one of the family members is more distressed about the level of knowledge that they have. And there are multiple different situations, but this is a good, I think it's a good way to work with it with the families. And again, we're very blessed in Minnesota. We're very lucky that we have a lot of excellent colleagues and resources at different levels. But yes, the whole idea is here, the welfare of the patient and the understanding and the trust and learning factor of the family and the patient.
Brandy, there's another question here. And I'm trying to read a little bit more into it because it's a short question. Do you have any examples of successful advocacy that have occurred? And there's the name of a particular retail organization, and I'm not going to name that organization, but I'll frame up the question for you is, does the Epilepsy Foundation get involved if they hear, if enough people come to Epilepsy Foundation and say this and this is happening and the common denominator is X employer, what kind of interventions do we have at that point?
Yeah, we absolutely do that. And in fact, we're engaged in that kind of activity right now with our advocacy team with two major retail pharmacy chains. Okay. So, you know, just so that you all know, there are, you know, conversations around things coming on formulary, off formulary, not being available. That's the time when Epilepsy Foundation jumps in and says, look, you need to understand the needs of people with epilepsy. And, you know, each individual patient is an individual. There's no blanket, you know, recommendations across the board for treatment for people with epilepsy, and the treatments that their provider and they think are the right, the best choices for them need to be available to them. So I can give you another example. There were a number of very disturbing videos floating around TikTok, which is one of these social media platforms. Yeah. And we became aware of them and immediately contacted TikTok and worked with them to have those videos removed, and then to work with them about, you know, finding ways to prevent that sort of thing from coming up again. So we absolutely take very seriously our responsibility to advocate on behalf of people in the corporate world, you know, just as much as we do in the congressional world.
Very good.
You bring a good point. I think like anything else in today's world with significant amount of social media and internet, you know, access, that there's a fair amount of misinformation too.
Yes.
And we have to be cognizant of that as well.
Yeah. Yeah. And I should say that TikTok was extraordinarily welcoming for us. I mean, they were very easy to work with. They understood the issues. They worked very quickly to resolve the situation. And so that was a really good success story all around.
Great. Well, I think that we are getting close to the end of our time here. Glenn, I'm assuming you have a few closing things to say. But before I hand things back to you, I want to thank Drs. Fuhrman and Espinosa, Brandy and Manti. I hope for all of you out there in the virtual world that this evening has been one that has expanded your knowledge of understanding of epilepsy. I think we got to all of the questions. If there were any other questions, Glenn, maybe you can give that. I know it's admin@EFMN, is it .org?
That's exactly it.
Website. Is that correct? Okay,
Yes.
good. So admin@EFMN.org. If any other questions come up from this session, or if we didn't address anything fully, let us know. I want to thank Glenn Lloyd and the staff of EFMN. You guys have organized and executed this expo beautifully. And I know there's always behind the scenes stuff, but this was absolutely terrific. And then I have a final quote before I sign off. And this is from Sam Weeb. He is the International League Against Epilepsy president. And he was right with the quote he has, he was writing, and it was within the context of COVID, which we really didn't even get into tonight. But when I think about his words, they applied for me to much in life, including epilepsy. And here they are. We must equip ourselves with fortitude and resilience in the face of uncertainty. Let us encourage one another to stay focused and not lose sight of a brighter future. Together, we can weather this storm. And we know we have COVID for a storm. I'm saying this. And we know there are a lot of other storms in our lives. But together, we can weather this storm or any storm and emerge stronger. Thanks to everybody tonight. And I'm signing off now. Back to you, Glenn.
Well, thank you, Tess, Dr. Fuhrman, Dr. Espinosa. What an engaging, comprehensive discussion you all have had. Really love that you put a guiding star, a North Star for Minnesota to run after and to achieve with the epilepsy learning healthcare system. It's really exciting to have these discussions and to rally our community. We have seen your advocacy in the chat box. Please know that you can reach out to us at the foundation. Tess has shared that our email address is admin@efmn.org. We really look forward to hearing from you. We look forward to supporting your journey and for advocating for all people impacted by epilepsies and seizures. This year has really brought up the importance of health and wellness, as Tess pointed to, and I'm glad that you were able to be with us tonight and to discuss these topics. I want to thank everyone who joined us tonight. For those who submitted questions, if you did not get your questions or you think of questions later, once again, please email us at admin@efmn.org, and we will work on answering those questions for you. Now, not only does this wrap up tonight's session, but it is also the last day of our Innovations in Epilepsy and Wellness Expo. I'd like to thank everyone for joining us this year, and I hope that you have taken away information that is helpful to you and your journey. You can expect to receive an email from EFMN tomorrow with information on recordings. And please share those as you see them as an opportunity to expand others' knowledge of the work happening within the epilepsy community. Lastly, the Epilepsy Foundation of Minnesota continues to provide one-to-one support through our information services. Since we are unable to meet in person, we do have virtual appointments available. You can schedule these appointments on our website, once again, efmn.org. We will continue to support individuals through phone calls and emails. So this is just an additional service that we hope you take advantage. As we roll into a very difficult season of a third spike in COVID infections in Minnesota and across the upper Midwest, we encourage you to stay safe. We encourage you to take a pause from gatherings outside of your household as to give everyone a chance to get to the spring where we hope to achieve vaccinations across our communities and be back in each other's presence as the spring and summer unfold next year. Until that time, we want to thank you for being with us and encourage you to have a wonderful holiday season. Please use Zoom, FaceTime, phone calls, text message, but do not spend time with one another as to increase your chances of having a very enjoyable holiday season. We will see you in year 2021. Have a great night. Thank you for your time. Have a wonderful evening.